A great number of employer-employee relationships exist. The Affordable Care Act, as originally written, did not fully address many of these variations and how they affect the employer mandate to offer health insurance coverage. Employee variations include full-time, part-time, seasonal, variable hour, collectively bargained arrangements, commissioned salespeople, and unique arrangements specific to certain industries such as pilots and teachers. Under the shared responsibility provisions of the Affordable Care Act, employers with 50 or more employees must offer their full-time employees a health plan with minimum value and affordable coverage or pay a tax. A full-time employee, as defined under the law, works on average 30 hours per week or more. Determining the number of hours worked on average can be challenging when it comes to part-time, seasonal, and variable hour employees. The Treasury Department has issued regulations to help employers reasonably determine if an employee crosses into the full-time definition of employment. These safe harbors address both new and ongoing employees. The safe harbor regulations allow an employer to look back retrospectively to determine if an employee worked on average 30 hours per week or more. This is called the standard measurement period. The standard measurement period can be administered in 3, 6, 9, and 12-month periods. Administrative periods are allowed so that calculations can be made. If a determination is made that an employee worked on average more than 30 hours per week during the standard measurement period, health coverage must be offered for a time period that at least equals the time period of calculation. This is identified as the stability period. So, for example, if a 6-month standard measurement period is used, a stability period of 6 months must be used as well. Most employers will find that using a standard measurement period of 12 months will work to their advantage in terms of administrative compliance and limiting plan enrollment. Similar rules apply for measuring new employees. If there is a reasonable expectation that an employee will be full-time, the maximum waiting period to enroll on a health plan is 90 days. If uncertainty exists as to the potential status of an employee, longer initial measurement periods can be used. Collectively bargained plans are not exempt from the provisions of the Affordable Care Act. However, many of these plans may be under so-called grandfathered status, allowing for relatively minor exceptions from certain aspects of the law. Contributions to a multiple employer plan will meet the shared responsibility requirements if coverage is offered to eligible employees, if the plan is affordable and has a minimum value, and the waiting period to enroll in benefits does not exceed 90 days. As mentioned, many different employment relationships exist. Regulations addressing professions with non-traditional work schedules, such as teachers and pilots, are broad and rely on historical practices. Under the law, the common law definition of employee is used. The rules distinguishing an employee from an independent contractor are fairly rigid and need to be carefully assessed by employers. For leased employees, the shared responsibility requirements ultimately fall on the leasing company. Determining which employees must be offered health insurance under the shared responsibility provisions of the Affordable Care Act can be complex. As originally written, the law failed to address the great number of employment arrangements. Regulatory guidance is beginning to address many, but not all situations. The Affordable Care Act is having a profound impact on employers, healthcare providers, and individuals. The Fedeli Group stands ready to help you navigate the complexities of this law.